Hi, Miss Morgan. My name's Jade. I'm the nurse practitioner here. Today we're going to be doing a head to toe assessment. So it should take hopefully 45 minutes to possibly an hour. Yeah, we'll start with the skin, hair, and nails. So I'm just going to kind of take a look.
Okay.
Ooh, I didn't bring any gloves anyway. Okay, I'm just gonna feel your skin. It's warm to the touch. No rashes, no red areas, no bumps, no swelling noted. Okay. Alright, and then next I'm actually just gonna feel, oops, sorry.
You're okay.
Your head, any tenderness there?
Mm-mm.
Okay. No baldness noted. Hair is gray and curly. Actually, okay, let's actually take a look at your hands here. Okay. Ooh, your hands are warm. Okay. Okay, so actually I'm just gonna pinch right here at your clavicle. Okay. Oops.
You okay?
Okay. So no dehydration or anything like that. Your hair is evenly just distributed. And like I said, no swelling, no cyst or anything like that. And then I'm actually going to have you kind of put your 2 fingers like this to check. And then actually we're going to touch the nail beds here.
Okay.
To check for any clubbing. Okay. And then the capillary refill is less than 3, so that's good.
Okay.
And then your nail beds are there's no cracks in your fingernails, and then the nail beds are thick and smooth, which is what we like.
Yep.
So then next we are actually going to move on to your eyes.
Okay.
And then first, and actually I should have had some gloves on. But anyway, I'm just gonna look at your eyes.
Okay.
And they are evenly set, and then I'm just going to place my hands here. Okay, then I'm going to pull down right here just to look at the conjunctiva, which is pink. Okay, sorry.
You're fine.
And we're actually going to, we'll actually do a couple tests, and then I will have you stand here and we'll test your eyesight. Yeah, if you'd like.
Okay. Where do you want me to go?
Stand right back there.
Okay.
At the end. Okay, and then I will actually have you cover your right eye, and then
Do you need that on me?
Well.
Not really.
So then I will have you
read the smallest.
Yep, read the smallest line for me.
Okay. L D Z C Z O T E.
Okay, read the line above it.
C F D T E O P.
Okay, and then switch eyes for me.
Okay.
And read the smallest line you can.
L D C Z O T E. I can read that bottom one a little bit.
Okay, we'll give it a try.
PTODTEL.
Okay, well yeah, that's good. Okay. And then I will actually have you sit back down for me.
Okay.
And then I am going to do what we call like a confrontation test, so which is going to test your peripheral. So go ahead and cover your right eye. Okay, then I'm going to cover mine, and then let me know when you see my hands come into view.
Yep.
Okay. Right here, cover other eye for me. Okay.
Yep. Yep.
Okay, perfect. Okay. Where'd my pen light? Okay, so then next, I'm gonna test your 6 cardinal. Whatever. Anyway, okay, so look at me,
Okay.
and then I'm going to move this pin light in a certain direction, and then without moving your head, just follow with your eyes. Okay.
Okay.
All right. Okay, perfect. Now, while looking at my nose, I'm going to bring this pin to your nose, okay?
Okay.
I meant to follow the pin, I'm sorry.
Okay, that's okay.
I'm sorry. Okay. And then your pupils, I say, are about, I'd say about a 5 millimeters. And then, so I'm just going to shine this light. Okay, so your pupils are round, reactive, and then accommodating to light, which is good. So your eyes are equal. There's no strabismus, there's no anisocoria, no nystagmus. And then actually when I do shine the light, I would say that your pupils go down to about a 3, which is anywhere from 3 to 5 is okay.
Okay.
All right. Okay, so then there's no, I don't notice any swelling or redness, flakiness on your eyelids or anything like that. So now what I'm going to do is,
Lord, I hope my ears are clean.
oh, well, I'll check your eyes first.
Okay.
And then we'll move on to the ears. So I'm just going to take this, I'm going to shine it in your light and check for some reflexes.
Okay.
Okay. So I'm just going to shine. Just going to move that. The red reflex is in there. Okay, now I'm going to go to the other eye here. Okay. Thank you. So no lesions or anything that I see. Okay. And then your upper and lower eyelids are symmetrical. And no discharge coming from the eyes. Your sclera is white and clear, so that is good. All right, so then now we're going to be moving on to your ears here. I'm actually going to swap this around. Okay, I'm going to be looking here. Alrighty, so we will actually just do this ear. So I'm just going to feel around and let me know if there's any tenderness.
Mm-mm.
Okay, nope. Any tenderness back here?
No.
Okay. So while we're back here, I'm just going to look in your ears here. Okay. So no cerebrum. The membrane is gray translucent. Okay, on this side. Oh, thank you. Actually, I must take that. Okay, and again, no pain in this ear. Okay, and again, it is gray and translucent. Any tenderness?
Nope.
Okay. All right, so I'll actually take this off. So no lesions noted in your ears, no perforations. And again, it's shiny gray and translucent. So next we will actually assess your hearing and also your cranial nerve 8.
Okay.
So I've been doing two tests. One would be the Weber test. So I'm just going to strike this and then I'm going to place it midline on your forehead.
Okay.
And then let me know if you hear it in one ear or the other or both.
Okay.
Okay.
Oop. Both.
Okay. Perfect. And then the next one we are going to be doing is the Ren test. So again, I'm going to strike this and then I'm going to put it back here on the mastoid process, and then I will move it to the ear right here, and then you're just going to let me know which one you hear it louder in.
Okay.
Ooh, that's not good.
There. In my
Next
ear.
to the ear?
Yep.
Okay. All right, thank you. Okay, so then next I'm going to do what they call a whisper test. So occlude one ear for me, just plug one ear up, okay? Then I'm just gonna whisper two things and you just let me know what you hear.
Apple, banana.
Okay, perfect. Other ear.
Blue bicycle.
Perfect. Okay. So now I'm just gonna assess your nose. Any recent bloody nose, any pain, any loss of smell?
Excuse
Bless
me.
you.
Thank you.
Okay, so I'm just gonna be looking up your
Okay.
nose with this. Okay. So the septum is midline. No lesions, anything like that. No drainage. Okay, I'm actually just gonna kind of palpate here. Okay, and then take a big deep breath. Well, in your nose, out your mouth. I'm sorry. Okay, and then I want you actually to hold one side, breathe in, out. Okay, other side. Okay. Okay. So there's no swelling, there's no perforations, no recent discharge or bloody nose, anything like that. So now I'm actually just going to place my hands on your face, and then you let me know if there is any tenderness here.
Nope.
Okay.
Nope.
Here. Okay. And then I'll be using that here pretty soon. So the next I am actually going to be feeling on your lymph nodes, and then I'll be listening to your thyroid and temporal artery for any bruise. And then we will test one more nerve, which would be the trigeminal, and then we'll be moving on to the head and neck. Okay? All right. So, oh my goodness. Okay. Okay, so I'm just going to be feeling here at your occipital. Post-auricular, pre-auricular. Okay, this is the submandibular, submental. Okay, then I'm gonna have to press just a little bit hard. I'm sorry.
That's okay.
4. Okay, deep cervical. Okay, so then now what I'm gonna have you do is lift up, shrug your shoulders like this. And I'm just gonna feel here for that. Okay. All right. Any tenderness there?
No.
All right, perfect. Okay, so then I am actually going to have you go ahead and clench your teeth together. Okay. All right. Any tenderness here?
Mm-mm.
Okay. Any up here?
Mm-mm.
Okay. Now open your mouth. Okay. Shut it. Okay. Perfect. Okay, so then next I'm going just to be using my stethoscope to listen for any bruise. I'm going to first listen to the temporal, which I'll use the bell.
Yeah.
Oops. Okay. And then next I'll listen to your thyroid, which I will have you hold your breath
Okay.
while I listen to this. So you let me
Okay.
know when you're ready.
I'm ready.
Okay. Big deep breath and hold for me. Okay, perfect. Thank you. All right, so the next we'll be doing the head and neck. So again, I'll just be assessing and palpating, kind of feeling around.
Okay.
And then after that, we will be moving on to the heart. Okay, so looking at your head, it's symmetrical. There's no one-sided weakness
No.
or anything like that.
No.
And again, I'm just gonna kind of feel around your skull here. Let me know if there's any tenderness. No lesions, no nodules that I feel. Anything like that? Okay. Sorry, I didn't mean to pat your head like
No,
that.
you're fine.
Okay, and then we are going to test the cranial nerve 7. So here I'm actually looking for symmetry, any unusual features or any pigmentation, anything like that. So first I'm going to have you smile and frown, puff out your cheeks, kind of do like a kissy face. Okay, close your eyes tightly. Okay, and then I'm going to try to open them and just make sure I don't. Okay, perfect. Thank you. So I already actually did listen and palpate the frontal and the maxillary sinuses, which you had no tenderness in, and then the mastoid process I already did without any tenderness. And then your scalp is symmetric. There wasn't any areas of concern for that. And your texture, your hair texture and color is normal, and then your hair is evenly distributed. Okay, so next we're going to just be looking at your neck, and then first I'm just going to do some simple range of motion.
Okay.
So lift your head up, down, side.
Oh,
sorry,
this
side.
way? Yeah.
Yep, side, and then ear to one shoulder,
Okay.
and then ear to the other. Okay, perfect. So patient doesn't have any skin folds, no swelling, no tenderness here. Okay. Perfect. So I am actually going to just feel for your trachea here. And here it is. Okay, and then I'm just gonna have you look to the left like that. Okay.
Oh, left.
Yeah, or yeah, that's fine. Cool, and then I'll have you swallow. Okay, look towards me, I'm sorry. And then swallow. Okay, perfect. So now I will just assess your thyroid. So I will have you hold this drink of water, but don't take a sip yet.
Okay.
So I'm actually just gonna come behind here
Okay.
and feel for your thyroid. Okay, now I will have you go ahead and take a sip of water. Okay, perfect. And then again, I will listen for any bruises here. Oh, I'm sorry, hold your breath. Okay, thank you.
You're welcome.
Okay, so actually gonna take this again and I'm just going to, I'm going to end up shining this light in your mouth here in a minute just to inspect your teeth and your buccal mucosa. Okay, so I'm just taking a look at your lips. I don't see any cyanosis. There's no cracks, anything like that. Okay, open up your mouth for me. Okay, say ah.
Ah.
Okay, so the uvula. No bruising. Intact. No cavities. Okay, and lift your tongue up for me. Okay. Perfect. Okay. And the tongue is symmetrical. There's no swelling or ulcerations. The buccal mucosa, there's no lesions. The color is accurate according to her race and ethnicity. There's no missing teeth. There's no abnormalities. Again, the skin is not chapped. There's no cracks. It's symmetrical. And for the gag reflex, I'm not going to do that, but you know, during this part of the assessment, we would do that. And then actually last, for this part, I'm just going to have you, I'm just going to have you stick out your tongue. Okay, lift it up, down, side, side. All right, perfect. All right, so next is the heart.
I have great gag reflexes, just so you know.
Oh.
Yeah.
Okay, so I'm trying to decide if I want to do that or that. Yeah, I guess we'll do the heart. Okay, so I'll actually just first I'll listen to the heart here,
Okay.
and then I'll be listening for any heart murmurs and
Okay.
things like that.
All right.
Okay.
Mm-hmm.
So gonna start here at the aortic using my diaphragm. This is pulmonic, Erb's point, tricuspid, and mitral valve. Okay, perfect. And actually, while I'm here, I'll just go ahead and listen for murmurs. And if you can, let me know when you're ready, and I'm gonna have you hold your breath because it's better.
Okay. I'm ready.
Okay. Okay. Again, aortic, pulmonic, Erb's point, tricuspid, mitral. Okay. All right. And then I probably actually will have you lay down at this point if that's okay with you.
Yep.
Yeah, we'll do. Put your head right here.
Okay.
Okay. All right. So we're just gonna kind of point out a few things.
Did you see? Okay.
Yeah.
Okay.
So the apex. Oops. Okay, so the apex is here. Okay, sternal border here. And I'm actually just gonna place my hands here to make sure I don't feel any heaves
Okay.
or lifts, anything like that. Okay. And then I didn't feel any thrills. And now I'm just gonna listen to your apical pulse here.
Okay.
And that's gonna be here at the 5th intercostal space here. And then I'm actually gonna have you roll towards that way, and I'm gonna listen to it in 2 positions. So
Okay.
that was the first one. And then right here. Perfect. Okay?
Okay.
And then you can roll back over towards me. Okay. And then I'm gonna come right here and just listen to your, we'll do it this way. Carotid artery here. Okay. Perfect. So no murmurs, anything like that. There was no heaves or lifts. And then again, I felt the apical pulse in 2 different positions, which is good. So now I am going to just kind of inspect your chest. I'll do a couple things while you're laying down here.
Okay.
And again, trachea is here, the substernal notch. Right there. Okay, and your trachea is midline, which is normal. No tripoding. Your lateral ratio is 1:2, which is normal. The ribs are not prominent at this point, but you know that's okay. There's no retraction. Respiration is regular, and no use of accessory muscles, anything like that. So actually, I'm going to now have you sit up for me, and then I'm just going to listen to lung sounds, and then we will make sure we don't hear any adventitious sounds like crackles, wheezes,
Okay.
bronchi, anything like that. Okay, alrighty. Big deep breath for me. And again. Okay, and then 2 more times. Let me know if you're getting dizzy. Okay. Alrighty. So no crackles, no wheezes, any bronchi, nothing like that heard. And now I am actually going to be placing I'll have you face that way if you don't mind. Okay, so I'm gonna check for tactile fremitus, and I'm just gonna place my hands along your back, and then once you feel my hands, just go ahead and say 99.
Okay. 99,
I'm sorry.
99, 99, 99, 99.
Perfect. So those are symmetrical and felt on both sides. So and then next we are actually going to feel, or actually measure your diaphragmatic excursion. So what I just actually going to use this little pen. I won't mark on you. Okay, so I'm going to just kind of place my hands and tap real quick.
Okay.
Oops, sorry.
That's okay.
Okay. Alrighty. Just mark it here. All right, now take a big deep breath and hold it for me. Okay. Okay. Perfect. Alrighty, you can. Yep. Thank you. So that is about 4 centimeters, which is okay, and no hoarseness in your breath or anything, or I mean in your voice or anything like that.
Nope.
So next we are going to go ahead and just auscultate and palpate a couple different things just to feel for your pulse and everything like that.
Okay.
How long is this video? Okay, we're doing good. Okay, so hand me your hands, just looking here. Okay, you see your feet here. Okay, now since I'm down here, I'll go ahead and well, no, you can Yep, perfect. Oh, don't have to do that yet, actually. So the extremities are warm, the pulse is equal, there's no tenderness, there's no edema in the bilateral lower extremities. And then let's see, we will I'll actually I'll have you lay back down again.
Okay.
I'm sorry.
It's okay.
Okay, so now I'm just going to be listening to a couple of pulses, carotid, abdominal, aorta, renal, iliac, and your femoral arteries. And that should not take long. Okay. All right. Okay, so I'm just going to listen to the aortic up here. Okay. Renal, iliac. Okay, and then the femoral is down here. And actually, while I'm here, if you don't mind, I'll just palpate here and let me know if you have any tenderness. I'll just do a light palpation here.
Nope.
Okay. Okay, now I'm just going to do a deeper one.
Nope.
Any tenderness?
Nope.
Okay.
Nope.
Okay.
Nope.
Okay. All right. So no bruise heard in any of the arteries or anything like that. Your skin is normal for your race ethnicity. There hasn't been any nail changes, no muscular atrophy, no edema, no skin texture change, anything like that. So next, if you don't mind, while you're laying down, can you go ahead and kind of lift the yep. Okay. And that's just checking for any masses, any separation of the muscles, no hernias noted. Now, I'm going to listen just to your bowel sounds. And I'm going to start in the right lower quadrant, move up to the right upper, left upper, left lower. Okay. Then we have already palpated anything like that. So it was soft, no lesions, no scars or anything. Your umbilicus is midline without any herniations. And then actually, I hate to keep having you get up and get down.
That's okay.
But yes, I will. Thank you.
You're welcome.
Okay. So now I'm just gonna percuss the costovertebral angles for any kidney tenderness. I'll sit behind you and you let me know if there's any tenderness. Okay.
Nope. Nope. Nope.
Okay, perfect. All right. Okay, so the everything is symmetrical and there's no bruise or anything heard. All right, so a couple more things. And we already did the heart, right?
Yep.
We did the heart. Abdomen. Chest and lung. Okay. Actually, we will do the musculoskeletal system first. So I'll just kind of palpate, and there's no tenderness, no erythema, no nodules, No masses, anything like that. Any pain anywhere?
Mm-mm.
Okay. None down here.
Nope.
Okay.
Nope.
Okay, and while I'm down here, I'll check for ankle clonus, so I'll just have you flex your foot. Okay, and she is negative for ankle clonus. Looking at the muscles, they're symmetrical. No spasms. There's no deformities. There's no swelling. No erythema. And then the extremities seem to be all symmetrical. No tenderness or swelling or crepitus felt on any of the bones and joints or the muscles. So now I'm just going to have you do a couple range of motion
Okay.
tasks. So first we will do your hands and wrists. So
Okay.
yeah, you can hold it. That's
Or
yeah,
do
that's
we-
fine. Yeah, that's fine. So what we'll do is flex, bring it down, extend, up. Okay, and then we will do the same kind of with your fingers.
Yeah.
Bring them down, bring them up, and then abduction, which is spreading apart, and abduction, which is bringing them back together. Perfect. So we'll do the same thing with your elbow.
Okay.
Bring it out. Okay, so flex it, bring it in, bring it out. Okay, and then we will do supination and then pronation. Okay, perfect. Any pain there?
Nope.
All right, so for the shoulder,
Mm-hmm.
I will have you just kind of bring your arm out and then bring your arm back. Yep, perfect. And then I will have you bring your arm across your chest and then bring it like you're scratching your neck. And then again, to scratch your back. Okay, perfect. Okay, and then next I will have you, I'll have you stand at the end. I'll have you lay back for me.
Okay.
Okay, then bring your leg up. Okay, perfect. And then again, I will have you roll towards that side. Okay, and if you can, bring your leg back towards me. Okay, and then up, and then back down. Okay, perfect. Alrighty, and sit back up for me.
Okay.
Sorry.
That's okay.
Okay, and then so next we will just do legs and knees, same thing, whichever knee or leg you choose.
Yeah. You
Bring
want
it-
to stand up or?
Oh no, that's fine. Bring it out, then back in, and then I'm actually gonna rotate it from side to side. No tenderness, no crepitus felt.
Nope.
Same thing for your ankle here.
Yeah.
Okay, bring it up, down, side, side, no pain, no crepitus.
Nope.
All right, perfect. So then next I'll have you stand up.
Okay.
And this is going to be for your cervical spine range of motion. So I will have you bring your chin to your chest, head up, to the right, to the left, and from shoulder to shoulder.
Wait, like that?
Yep.
Okay.
Perfect. And then you can go ahead and face it this way
Okay.
towards this wall here. And then we will just be checking the spine here. So what I'll have you do is bend over and touch your toes. Okay. And just palpating here. Let me know if there's any tenderness.
Nope.
No, normal. There's no scoliosis noted. Okay. Then I'll have you stand up for a second. Okay. Curvature is normal. And then bend back for me like this. Okay. Perfect. No pain.
Nope.
Okay. Then twist from side to side. And then kind of go like this. Like little ankle touches. Perfect. So no pain there. Range of motion is adequate. And, okay. So, actually next I'm just going to be testing your reflexes here, and you can go ahead and sit down, and then we will do the neuro assessment and then a mini mental exam, and then we are done.
Okay.
All right. So I will just test the reflexes here. Okay, and then again. Okay, perfect. And then we will do the elbow here. Just kind of let this hang a little bit.
Can we move over?
It's fine.
Okay.
Oh,
Yeah,
that
was
worked.
a good.
Oh.
That was a good one.
Okay, and then kind of the same thing here. Your, oh wait, tricep up here. Okay. All right. So next we'll do your knee and your Achilles
Yeah.
tendon. I don't know where that paper went, but either way. Okay, so we will do your knee here. Okay, and then Achilles, I'm going to use the other side of this hammer. Okay, perfect. Okay, so the next we will do the neuro exam along with the mini mental exam. Are you able to tell me the year,
2022,
the month,
December.
the day of the week,
It's Wednesday.
and then can you actually just give me today's date?
Yes, December 7th, 2022.
Perfect. So I am actually going to say 3 words,
Mm-hmm.
and then I am going to ask you to repeat it, and then we'll do a couple things, and then I'll ask you to repeat these same 3 words. Apple, pen, table.
Apple, pen, table.
Okay, great. So then now I'm going to have you start from 100 and then subtract 7 5 times.
Ooh, okay. 193.
Okay?
86. 79.
Mm-hmm.
72. And 65.
Okay, perfect. Now, can you repeat those 3 objects for me or words?
Yeah, pen, table, apple.
Yep. Okay, perfect. Okay. And then I'm going to point out 3 things and you just let me know what they are.
Okay. Pen.
Oops. I dropped that. Hold on. And,
Phone.
okay, perfect. And repeat for me, no if, ands, or buts.
No ifs, ands, or buts.
Okay. And next, I am going to give you a command,
Mm-hmm.
and then I would like for you to follow that command for me. So I'll just do. Okay, so take this piece of paper,
Okay.
fold it in half. Okay, and then place it on the floor. Okay, and then I'm going to write a command on a piece of paper. Oh man. And then I will have you follow that command as well.
Okay.
Okay, perfect. Thank you. Okay, and then I am going to have you write a sentence that has a subject and a verb. Oh yeah, yeah.
See it like I knew. The house is gray. Yeah.
Okay, perfect. And then I'm going to draw an object, and then I will have you just mimic that drawing. Excuse me.
There you go.
Okay, perfect. Thank you. All right, so last but not least, we will go ahead and just do a neuro exam. We kind of already did a couple of these things as we were going through the head to toe assessment. So we have already tested cranial nerve 2, which is your optic. We did the confrontation test, which is what we covered your eye, and then we tested your peripheral.
Right.
We also did the Snellen chart, which tests your visual acuity. We did cranial nerve 3, which is the ocular motor, which is, the pen light and testing if they react to your light or the light. And then we did cranial nerve 4, the trochlear, which is the 6 cardinals of gaze, when I did the H and had you follow. We also actually did cranial nerve 5, which is trigeminal, when I had you clench your teeth open. But actually there's a few more tests, so we can actually do that as well. And then I'll have you do a couple of commands, and then that will be the end of the assessment.
Okay.
So I am going to get something for you to smell, and that'll be the first thing that we
Okay.
will test is the cranial nerve 1, which is the olfactory, which is your scent. So I'm going to have you close your eyes.
Okay.
And I'm going to have you smell this. Let me know what it is.
Ooh, mayonnaise.
You don't like mayonnaise?
Yeah, I love mayonnaise.
Okay, I was about to say. Okay. Okay, so that is intact. So we will actually do a few more tests to test the cranial nerve 5, the trigeminal. So again, I will have you clench your teeth. Then I'm just going to feel the masseter muscle here and make sure that there's no pain. Okay, perfect. And then what I'm going to have you do is open your mouth, and then I'm going to push on your mouth and just keep it open. Okay, perfect. So no deviations, nothing like that. So next I'm just going to ask you to close your eyes, and then you let me know once you feel something. It'll be on your face.
Oh,
Sorry.
Okay.
If it's dull or sharp.
Okay. Dull. Sharp.
Okay.
Sharp. Dull. Sharp. Dull.
Okay, perfect. All right, and then we will test cranial nerve 7, which is your facial. I am gonna have you raise your eyebrows, close your eyes, puff out your cheeks, smile. Okay, and then again, we already kind of did this with the eyes. I'll have you close your eyes, and then I'm going to try to raise them. Just keep them closed. Okay, perfect. And then the next one is the cranial nerve 8, and we did that with the Weber test, placing the tuning fork midline of your forehead, and then the Ren test. We also did the whisper test. So again, we have also already tested a cranial nerve 9, which is the glossopharyngeal, but we'll do it again. This would be the time where someone would elicit your gag reflex, but we're not going to do that. So I am actually going to just have you say okay, perfect. And then stick your tongue back out, wiggle, well, not wiggle, I'm sorry, move from side to side. Okay, up and down. Okay, perfect. Okay, so, and then we will do a cranial nerve 7 or 11, which is accessory. So I'll have you, sorry, I didn't mean to step on your toe. Okay, I'll have you, see, this time we'll just have you move your head around in a circle because we've already did the range of motion. Okay, so to test this, all right, to test this, I'll have you raise your shoulders. Okay, don't let me push it down. All right, perfect. Okay, so the next one is just going to be some simple commands. And then that will be it. So what I'm going to have you do is just, this is just going to be testing your rapid motion.
Yeah.
So, I'll have you go like this back and forth on your knees. Okay. Okay. Yep, perfect. Okay,
Okay.
and then we will place your heel to your knee and slide it down.
You want me to get up?
No, you can do it. Okay, on both. Okay, perfect. So next I will have you stand
Okay.
up.
Yep.
Okay, and then close your eyes for me.
Okay.
Okay, and then go ahead and stick your hands out. Okay. And then go ahead and turn them upside down.
Oh, okay.
Eyes closed.
Yep.
Yep. And then if you can, just kind of march in place with your hands down. Put your hands back. Yep, there you go.
Okay. Slid on the floor there for a minute.
Okay, perfect. And then what I will have you do is just walk to that Christmas tree over
No,
there.
with my eyes open, right?
With your eyes open.
Okay.
Casually. Okay, and then when you turn back around, just place one foot in front of the other.
Okay.
Okay, perfect. All right, and so I'm gonna do what they call like a 2-point. Oh, you can go ahead and sit down. Thank
Okay.
you. So I'm just gonna be pricking your hands, arms, feet, legs with something that is sharp and something that is dull. Just let me know when you feel it.
Okay.
Okay?
Close my eyes?
Yes.
Okay.
Please. Okay.
Sharp. 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 Dull. Dull.
Okay. Right here.
Dull. Sharp.
Okay.
Dull. 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 Sharp.
Okay. Perfect. Okay, and then we're gonna do a 2-point discrimination test. So again, I'm gonna have you keep your eyes closed.
Okay.
You're gonna let me know if you feel 1 point of contact or 2.
Okay.
Okay? And we will just go ahead and just stick with your right hand here.
2. 1. 1. 2. 1.
Okay, other hand.
2. 1. 1. 1.
Okay, perfect. All right. So then, okay. So the next, we'll just stick with your right. I'm gonna move your finger
Okay.
up and down. You let me know with your eyes closed
Okay.
if the finger goes up or down.
Okay. Down. Up. Down. Down. Down.
Okay, perfect. And then, so I'm just going to trace either letters or numbers in your hand. And then you let me know, just identify what letter, what
Okay.
number.
T.
Yep.
B.
Yep.
C. L.
Yep. All right. So we already, and then, we checked the bicep reflex, the tricep, the patellar. We did the Achilles. We checked for the ankle clonus, which is when I flexed your foot here. So then actually what I'm going to do is lastly to do the plantar reflex, I'm just going to have your foot here. Then I'm just going to brush this across the bottom of your foot.
Yeah.
Okay, and that's a normal reflex there. And then lastly, I'm going to have you lay back down one last time and we're going to check your abdominal reflexes.
Okay.
So where'd my cotton swab go? Where'd my darn cotton swab? Well, anyway.
You can't see.
I was gonna say, we'll use a, so this abdominal reflex is just, I'm just gonna brush this across your abdominal reflex and then, I know, it's okay. So, Okay, what we're looking for is that contraction, so which means that they're intact.
Yep.
Okay, and then that is the end of the head to toe assessment.
Thank you very much.
You're welcome.